Hi, hello everyone. Welcome to Dr. Ravichandra official. In this video, we will discuss mediators of inflammation. This may be asked in your essay question like define inflammation, describe the cellular and other events that are involved in inflammation, cellular and vascular events in inflammation, and what are chemical mediators or what are the mediators of inflammation. This can be asked even for 6 marks question, mediators of inflammation. And even in this, there are many mediators. All those mediators can be asked individually for 6 marks or 3 marks question. So this is a very important topic. So please listen carefully to the video. Let's start the video. Mediators of inflammation. Mediators of inflammations are the substances that will initiate and regulate the inflammatory reactions. Among the many mediators, the most important ones are amines, vasoactive amines, leukotrienes, prostaglandins, cytokines. Among the cytokines, there are one more entity called as chemokines and complement and products of complement activation. These are all the mediators, important mediators of acute inflammation. Mediators are formed, okay, we can understand it. From what they are forming, they can be either secreted by the cells or from the plasma proteins. So, what are all the cells that will produce mediators? Will be mainly macrophages, dendritic cells, and mast cells. Along with these, platelets, neutrophils, endothelial cells, and most of the epithelia will also help in elaborating some of the mediators. Now, plasma derived mediators are produced in liver and are present in the circulation in active form. Active mediators are produced only in response to microbial products and substances released from necrotic cells. And most of the mediators are short-lived. When once one mediator is stimulated, it can stimulate the release of other mediators. So, if one mediator is produced because of the stimulus, it will help in stimulating the release of the other mediators. First, we will discuss vasoactive amines. These are stored as preformed molecules in the cells, and they are the first mediators to be released during inflammation. So, vasoactive amines are the first mediators to be released during inflammation. This is a very important point. Among the various vasoactive amines, histamine stands the first place. It is present in mast cells, basophils, and platelets, and it is stored in mast cell granules and released by the degranulation of mast cell in response to a various stimuli. These stimuli can be physical injury or anaphylatoxins or neuropeptides or cytokines. Physical injury may be because of trauma, cold or heat. Binding of the antibodies to mast cells which underlies immediate hypersensitivity reaction. Anaphylatoxins involved are C3A and C5A. Neuropeptide is substance P and cytokines are IL-1 and IL-8, that is interleukin 1 and 8. Now, what this histamine will cause? Histamine will cause dilatation of the arterioles, arteriolar dilation, increased vascular permeability in venules. It is the principal mediator of immediate transient phase, and they will contract the smooth muscles. So, histamine mainly causes three functions. One is arterioles dilatation, increased vascular permeability in venules, and contraction of some smooth muscles. Serotonin, also called as 5-hydroxytryptamine, it is present in platelets and certain neuroendocrine cells. It is a neurotransmitter in the gastrointestinal tract. It will cause vasoconstriction during the clotting. Serotonin, vasoconstriction, and neurotransmitter. Arachidonic acid metabolites. This can be asked for 6 marks or 3 marks questions. Arachidonic acid metabolites of eicosanoids are the most potent mediators of inflammation. So the most potent mediators of inflammations are arachidonic acid metabolites, and they are derived from arachidonic acid released from the cell membranes using cyclooxygenase and lipooxygenase pathways. The lipid mediators prostaglandins, leukotrienes are produced from arachidonic acid present in membrane phospholipids and will stimulate vascular and cellular reactions in acute inflammation. So, from the cell membrane phospholipids, phospholipases will act and result in arachidonic acid formation. Steroids inhibit this process by acting on phospholipases. When arachidonic acid is formed in the presence of cyclooxygenase, it will help in formation of prostaglandin G2, and from prostaglandin G2, prostaglandin H2, and prostaglandin H2 from it prostacyclins PGI2 and thromboxane PGD2 and PGE2 will be formed. This cyclooxygenase can be inhibited by COX-1 and COX-2 inhibitors, aspirin, indomethacin. From the arachidonic acid, if there is 5-lipoxygenase, then it will enter into 5-lipoxygenase pathway, thereby releasing 5-HPETE, which will convert into 5-HETE, which will help in chemotaxis. If there is 12-lipoxygenase enzyme available, then this arachidonic acid will help in formation of leukotrienes. Leukotriene A4, leukotriene C4, leukotriene D4, leukotriene E4, and leukotriene B4. So simply from cell membrane phospholipids in the presence of phospholipases, arachidonic acid will be formed. And this arachidonic acid in the presence of cyclooxygenase will go into cyclooxygenase pathway, resulting in formation of prostaglandins and prostacyclins. Arachidonic acid with the help of lipoxygenase pathway using 5-lipoxygenase will produce 5-HETE, and with the help of 5-lipoxygenase and 12-lipoxygenase it will help in formation of leukotrienes A4, B4, C4, D4, E4 and lipoxins A4 and B4, which will all help in inflammation. Cyclooxygenase is inhibited by COX-1 and COX-2 inhibitors, aspirin and indomethacin. Phospholipases can be inhibited by steroids. So, we will discuss one by one in detail. Prostacyclin PGI2 will cause vasodilatation, inhibit platelet aggregation. Thromboxane A2 will cause vasoconstriction and promotes platelet aggregation. So, prostacyclins and thromboxanes will act oppositely. Prostacyclin will cause dilatation and inhibit platelet aggregation, whereas thromboxane will cause vasoconstriction and promote platelet aggregation. So remember, this is for easy remembering. I am saying thrombox. So it is boxing. It is promoting aggregation. Promoting aggregation. How can they aggregate? If there is vasoconstriction. Remember like that. So thromboxanes will cause vasoconstriction and promote platelet aggregation. Opposite to thromboxanes is prostacyclins. They will cause dilatation of vasodilatation and inhibit platelet aggregation. Prostaglandin D2 and E2 will cause vasodilatation and increased vascular permeability. 5-HTE helps in chemotaxis. Leukotriene B4 helps in chemotaxis. Leukotrienes will help in vasoconstriction, bronchospasm, increased vascular permeability. So, coming to lipoxins, lipoxin A4 and B4 will inhibit neutrophil adhesion and chemotaxis. So, questions can become like this. Chemotaxis is promoted by leukotriene B4. Chemotaxis is inhibited by lipoxins. Increased vascular permeability is caused by prostaglandin D2, E2, and leukotrienes. Neutrophil adhesion is inhibited by lipoxins. Platelet aggregation and vasoconstriction is caused by thromboxanes. Now we will discuss prostaglandins. They are produced by the mast cells, macrophages, endothelial cells, and few other cells. And these are generated by action of two cyclooxygenases. One is COX-1, cyclooxygenase 1, and cyclooxygenase 2, that is COX-2. PGE2 will help in vasodilatation and increase the permeability of the postcapillary venules. So remember PGE2 vasodilation and increased vascular permeability. PGD2 chemoattractant for neutrophils. PGI2 causes vasodilation and inhibits platelet aggregation. Thromboxane TXA2 will cause vasoconstriction and promote platelet aggregation. Thromboxane platelet aggregation. PGI2 inhibition, platelet aggregation inhibition. Neutrophil chemoattractant is PGD2. Increased permeability, vascular permeability is caused by PGE2. Vasodilatation is caused by PGI2 and PGE2. Vasoconstriction is caused by thromboxane 2. Leukotrienes. These are produced by leukocytes and mast cells by the action of lipoxygenase enzyme. LTB4, leukotriene B4 is a potent chemotactic agent and activator of neutrophils. So it helps in chemotaxis. Leukotriene C4, D4, E4 are causing intense vasoconstriction, increased permeability of venules, and they also act as bronchoconstrictors. So leukotriene B4 is potent chemotactic agent. LTC4 D4 E4 leukotrienes D4 E4 and C4 are bronchoconstrictors, vasoconstrictors, and promote vascular permeability, increased vascular permeability. Lipoxygens are Lipoxygens are generated by lipoxygenase pathway from arachidonic acid. They will suppress inflammation by inhibiting the recruitment of the leukocytes. So they will lipoxygens suppress the inflammation. Cytokines and chemokines. Cytokines are the proteins produced by many cells that will mediate and regulate the immune and inflammatory reactions. Tumor necrosis factor. It is produced by activated macrophages, mast cells, endothelial cells, and T lymphocytes. Tumor necrosis factor will stimulate expression of endothelial adhesion molecules and secretion of other cytokines. It is involved in the systemic acute phase response like fever, sepsis, and cachexia. So, in MCQ, they can ask tumor necrosis factor is produced by activated macrophages, mast cells, endothelial cells, and T lymphocytes. Tumor necrosis factor will cause fever, sepsis, cachexia. Acute phase response is created by or produced by tumor necrosis factor. Interleukin 1. It is produced mainly by the activated macrophages, endothelial cells, and few epithelial cells. And this interleukin 1 action will be similar to the tumor necrosis factor. Along with this, it also activates tissue fibroblasts. It has a greater role in fever. So, fever is caused by both tumor necrosis factor and interleukin 1. Fibroblasts are activated by interleukins. Tumor necrosis factor and interleukin 1 have similar actions. Interleukin 6, it is produced by macrophages and it will induce the systemic acute phase response. Interleukin 17 is produced by T lymphocytes and it is involved in neutrophils and monocytes recruitment. Okay. Neutrophils and monocytes recruitment is caused by interleukin 17. Interleukin 12 is produced by dendritic cells and macrophages. They will stimulate the increased production of interferons. So interferons are production is increased by the presence of which interleukin? They will ask. Interleukin 12. Now coming to interferon gamma. Interferon gamma is produced by nature killer cells and T lymphocytes. They will activate the macrophages. So macrophages activation, for macrophage activation, we need interferon gamma and it is produced by natural killer cells and T lymphocytes. Interference production is increased by interleukin 12. Now coming to chemokines, this may be asked for 6 marks or 3 marks. Chemokines are a family of small proteins that act primarily as chemoattractants for specific type of leukocytes. So the name itself is saying these are the mediators or proteins that will help in chemoattraction, chemotaxis of leukocytes. Classified into 4 major groups according to the arrangement of cysteine residue. So chemokines are divided into mainly 4 based on the arrangement of the cysteine residue. First one, CXC, chemokines. They will cause activation and chemotaxis of neutrophils and they are secreted by activated macrophages, endothelial cells. IL-8, interleukin 8 is typical of this group. So CXC chemokines will help in activation and chemotaxis of neutrophils. Interleukin 8 is a classical example of CXC chemokines. Next, CC chemokines. They include MCP1, eotaxin, MIP1 alpha, and RANTES. They will attract monocytes, eosinophils, basophils, and lymphocytes. So, CXC chemokines will attract the neutrophils. Remaining leukocytes are attracted by CC chemokines, and they are MCP1, eotaxin, MIP1 alpha, and RANTES. C chemokines. These are specific for lymphocytes. Next, CX3C chemokines. Fractalkine belongs to this and it will attract and promote strong adhesion of monocytes and T cells. So in the MCQ, they may ask CXC chemokines help in which cells activation? Neutrophils attraction. C chemokines, lymphocytes. Fractalkine or CX3 chemokines, monocytes and T cells adhesion. CC chemokines will attract monocytes, eosinophils, basophils, and lymphocytes. Now coming to complement system, this can be asked in 6 marks and 3 marks question. Complement system is a collection of soluble proteins and membrane receptors that will function mainly in host defense against the microbes and in pathologic inflammatory reaction. So these are a collection of soluble proteins and membrane receptors which will help in host defense mechanism and pathological inflammatory reactions. Functions in both innate immunity and adaptive immunity. So complement system will function both in innate and adaptive immunity. Complement proteins are present in inactive form in plasma. So they have to be activated. The critical step in complement activation is proteolysis of the third component C3. So complement activation starts with proteolysis of C3. Cleavage of C3 can occur by three pathways. One is classical pathway, other is alternate pathway, and the third one is lectin pathway. So to get activated complements, first there should be proteolysis of C3, and this proteolysis of C3 can be done by classical pathway or alternative pathway or lectin pathway. Classical pathway is which is triggered by fixation of C1 to antibody that has combined with antigen. So classical pathway is by fixation of C1 to antibody that is combined with antigen. Alternative pathway can be triggered by microbial surface molecules in the absence of antibody. So classical pathway will happen in the presence of antibody. Alternative pathway will happen in the absence of antibody. Lectin pathway, in which plasma mannose binding lectin will bind to carbohydrates and microbes and directly activate C1. So for C3 proteolysis, C1 to be fixed or activated. So in the presence of antibody, it is classical pathway. In the absence of antibody, it is alternative pathway. If there is availability of carbohydrates and lectin, directly C1 can be activated by lectin pathway. The activation of complement is tightly controlled by few inhibitors or circulating regulatory proteins. C1 inhibitor, DAF, decay accelerating factor, factor H, and CD59. So complement is a group of collection of soluble proteins, and for that they will be in inactive form. To get that activated, first there should be C3 proteolysis. Cleavage of C3 should be done. C3 cleavage should be done, can be done with the help of classical pathway or alternative pathway or lectin pathway. With the presence of antibody, C1 is fixed. Without the presence of antibody or in the absence of antibody, alternative pathway will happen. And in the presence of carbohydrates and lectin, lectin pathway will happen. All will lead to activation of C1, which will further activate the cleavage of C3. So this it is a tightly controlled process, and there are many inhibitors causing this process to be delayed or derailed. They are C1 inhibitors, DAF, decay acceleration factor, factor H, and CD59. So main functions of the complement system is inflammation. C3A, C5A, and C4A anaphylatoxins will stimulate histamine release from the mast cells and thereby resulting in increased vascular permeability causing vasodilation. So C3A, C5A, and C4A complements are involved in histamine release from mast cells and resulting in increased vascular permeability and vasodilation. C5A is chemotactic for neutrophils, monocytes, eosinophils, and basophils. Opsonization and phagocytosis is one more function of the complement system. It is done with the help of C3b and IC3b. C3b and IC3b, when fixed to a microbial cell wall, will act as opsonins and promote phagocytosis by the neutrophils and macrophages. Next function is cell lysis. A deposition of membrane attack complex MAC on the cells makes the cells permeable to water and ions, resulting in death of the cells and some bacteria such as nice area. So, inflammation, opsonization, and phagocytosis and cell lysis are the main functions of complement system. C3A, C4A, C5A will help in mast cells releasing the mediators and thereby promoting inflammation. C3b and IC3b helps in opsonization and phagocytosis. Membrane attack complex deposition, MAC deposition will help in cell lysis. So, in a nutshell, there will be three pathways: classical pathway, alternate pathway, and lectin pathway. Classical pathway, here C1 is activated with antigen antibody complexes. Alternative pathway will happen in the absence of antibodies. So pathogens or apoptotic tissues will help. In lectin pathway, serum lectin will bind to the mannose on the pathogens. They will result in cleavage of the C3 in the presence of C3 convertase. So in all this process, C1, C4 and C2 will help. Even C3b will also help. This C3 is converted to C3a and C3b. C3a main function is inflammation. C3b is opsonization. Again, this C3b will activate the C5 in the presence of C5 convertase and break down it into or cleavage it into C5a and C5b. C5a again will help in inflammation. C5b will initiate the membrane attack complex. When membrane attack complex C5b, C6, C7, C8, C9, with this there will be terminal pathway because of the cell lysis. So what are all the pathways that are there in complement system activation? Classical pathway, lectin pathway, alternate pathway, and terminal pathway. Terminal pathway is caused by membrane attack complex C5b, C6, C7, C8, C9. Classical pathway involves antigen antibody complex formation resulting in C1 fixation, which will help in C3 cleavage. Lectin will bind to mannose in lectin pathway and result in C3 cleavage. Absence of antibodies, C1 gets fixed, resulting in cleavage of C3 using alternative pathway. C3 is cleaved into C3A and C3B in the presence of converting enzyme through classical or lectin or alternative pathways and result in C3A and C3B. C3A is involved in inflammation. C3B promotes opsonization. C5 gets cleaved into C5A and C5B in the presence of C5 convertase and C3B complement. And this C5A will help in inflammation and C5B will initiate the membrane attack complex or terminal pathway, which will help in cell lysis. So C3A, C5A are involved in and C4A, anaphylatoxin, are involved in inflammation. C3B helps in opsonization. C5B will initiate membrane attack complex and C5B, C6, C7, C8, C9 will help in terminal pathway or cell lysis, thereby helping in inflammation process. Other mediators of inflammation will be platelet activating factors. They are phospholipid derived mediators. They will cause platelet aggregation, vasoconstriction, and bronchoconstriction. At low doses, it induces vasodilation and increased vascular permeability. So, platelet activating factor in low doses will cause vasodilation and increased vascular permeability, but mainly it causes platelet aggregation, vasoconstriction, and bronchoconstriction. Kinase system. Vasoactive peptides derived from plasma proteins are called as kininogens. By the action of specific proteases, called calcareins. Bradykinin increases the vascular permeability, causing contraction of the smooth muscles, dilatation of the blood vessels, and pain when injected into the skin. Its function is almost equal to the bradykinin. Sorry, histamine. Bradykinin and histamine will have same functions. Neuropeptides are secreted by sensory nerves and various leukocytes. They will play a role in the initiation and regulation of the inflammatory response. Neuropeptides examples are substance P and neurokinin A. So, altogether, in a nutshell, there are various mediators of inflammation, and the main one is arachidonic acid pathway. Arachidonic acid is formed from cell membrane phospholipids in the presence of phospholipase, and arachidonic acid in the presence of cyclooxygenase will result in formation of prostaglandins and prostacyclins, thromboxanes. With the help of lipoxygenase pathway, it will result in formation of leukotrienes and lipoxins. Lipoxins will inhibit inflammation. Leukotrienes LKTB4 or LTB4 will help in chemotaxis. Leukotriene C4D4 E4 will cause vasoconstriction, bronchospasm, and increased vascular permeability. Prostaglandin D2 and E2 will cause vasodilatation and increased vascular permeability. Thromboxane A2 will cause vasoconstriction and promote platelet aggregation. Prostacyclins will cause PGI2 will cause vasodilatation and inhibit platelet aggregation. Along with this, chemokines and complement system will also help in inflammation. They are also come under the mediators of inflammation. Chemokines are arranged into four groups based on the cysteine residue arrangement. CXC will activate neutrophils. CC will activate other leukocytes, and C chemokine is for lymphocyte, and fractalkine will promote the inflammation. Complements C1 to C9. For the process to begin, C3 should be activated. C3 will be activated with the by cleavage, and it will be getting activated with the help of three pathways: classical pathway, alternative pathway, and lectin pathway, where C1 is first fixed. After the activation of C3, C1, it will, with the presence of convertase enzyme, C3 is broke down into C3A and C3B. C3A will help in inflammation, and C3B, in the presence of C5 convertase, will cleave the C5 into C5A and C5B. C5A again help in inflammation. C5B will initiate the membrane attack complex. This membrane attack complex will help in cell lysis by terminal pathway, including the C5, B, C6, C7, C8, C9 complements. Kinin, bradykinin, has the function similar to that of a histamine. They will cause arteriolar dilatation and smooth muscle contraction and increased vascular permeability. Thank you for patient listening. Please like, share, and subscribe Dr. Ravichandra Official for more interesting videos.